Hey guys, Dr. Walker here from Longmont Joint and Spine. In preparation of our upcoming Lumbar Spine Month on social media, I just wanted to cover some basics about low back anatomy. I think it's important to start by just pointing out the fact that there are 5 lumbar vertebrae. They're all separated by these little shock absorbers called the intervertebral discs. Now surely you or someone you know has experienced a lumbar disc injury, things like a bulge or a herniation, kind of represented by this little red bulge here. We are going to dive into that in detail this month, but that'll be week 2. For now, we're going to stick to basics. The vertebra itself is comprised primarily of this thick, dense platform on which the disc sits called the vertebral body. Now, from the vertebral body, you'll see these little projections. So we have lateral projections called the transverse processes, and we have one posterior projection called the spinous process. The spinous process is what you see on a person sticking out of their skin. It is what we palpate. These, along with the transverse processes, just make a really good attachment site for muscles and ligaments to aid in movement of your spine. Now, on either side of the spinous process, you see this flatter surface here called the lamina. The lamina, when you look at a cross-sectional view of a vertebra, is this portion here. The lamina, along with this, called the pedicles, and the backside of the vertebral body, make this bony ring that protects the spinal cord. Now, if you've ever heard of a laminectomy, that's a procedure in which a surgeon will saw through the bone here and here, removing this backside of the vertebra to alleviate pressure on the spinal cord. Now, there's one more thing that I think is worth talking about, and that's these guys. Those are called the facet joints. Now, the facet joints, each one is made of an inferior projection from the vertebra above and a superior projection from the vertebra below. Together they make the facet joints. Now the facet joints prevent hyperextension of your spine. So we can all bend forward at the waist and touch somewhere in the ballpark of our toes, but none of us can bend over backwards at the same degree. That's because of the action of the facet joints. When we bend backwards, they lock. Now these can become inflamed and often contribute to what we would call non-specific low back pain, the kind of low back pain that we all experience. We're going to dive into greater detail about non-specific low back pain next week. This Sunday, Dr. Williamson is going to post a video going over the basics of what structures are involved, how does non-specific low back pain work, what do we do here in the office to treat it, and what should you be doing at home to treat it. Until then, take care of yourself.